Child-centered play therapy is a model of therapeutic intervention that teaches children to communicate or express themselves in a way that is developmentally appropriate for them. The play therapy sessions are conducted by a psychologist trained as a play therapist. The play therapy room is full of therapeutic toys that are placed in a specific way. There are also specific categories for the therapeutic toys: aggressive toys, action figures, guns and swords; creative toys, crayons, sand and paint; real-life toys, dollhouses and baby dolls. Child-centered play therapy is most effective for children aged 2 to 12 and can assist with child mental health, for instance, ADHD, obsessive-compulsive disorder, anxiety, and oppositional defiance disorder. The symptoms for these would include bedwetting, nail-biting, temper tantrums, and social withdrawal. Child-centered play therapy is also useful for managing traumatic experiences such as death, parent separation, natural calamities, and abuse. The play therapy is usually conducted in half-hour sessions with the therapist and child present. The parents will usually meet with the therapist before and/or after the play therapy session. At the beginning of the session, the therapist will invite the child to play and explain that they are free to play in many of the ways they want to. The child chooses what toy to play with, and the therapist will follow along and engage with the child by reflecting the child's actions. For example, the therapist might say, "Looks like you've noticed the sandpit," or "You know just how that works." By reflecting only and not directing the play, the therapist gives the child space to make choices and express what is happening in their emotional world, and then gives them the opportunity to be understood. While the child directs the play during the session, the therapist will set limits or boundaries, and the child then works to regulate themselves to stay within these limits. This is a helpful practice as the child's world is full of limits that need to be maintained. This is a beneficial foundation tool for parents and teachers, as the child's experience of self-regulation during the sessions will flow out into normal life and become part of the child's everyday behaviour. Children are cognitively and emotionally linked and are not able to disconnect their emotions from their thoughts until they are 10 years old. Developmentally, their language skills lag behind their cognitive development. Play is their language and how they communicate. So play therapy lets children communicate with an adult who is not responding in an emotional way at all. The child is free to come back time and again to the same toy to explore the issue over and over again until they understand it and then can let it go and move on. The therapist is able to gain an insight into what is happening for the child. Play therapy is an emerging evidentiary research-based therapy that is practiced now in over 30 countries around the world. Virginia Axeline created 8 principles in 1911, which guides the therapist in the child-centered play therapy, although an experienced therapist can use their understanding of the situation to incorporate other aspects of other theory-based therapies too. All of this creates an active relationship living in the moment. It is non-directed and spontaneous, and this is the opposite to the child's current relationships with adults. Outcomes of play therapy for the child are that they develop more of a positive self-concept and assume greater self-responsibility. They become more self-accepting, self-reliant, and engage in self-determined decision-making while experiencing feelings of self-control. Children become sensitive to the process of coping and develop an internal source of evaluation as they become more trusting of self. To get a clearer understanding of the child's dilemma, it is crucial for the families to be involved. With the family's involvement, shifts in the child's behaviour can be observed early. Outcomes of play therapy for families and parents include the child responding differently to limit setting and boundaries. As the child's feelings have been recognised but not the behaviour, during anxiety-producing situations it will take the child longer to respond due to a shift in their way of thinking. Parents will also gain an insight into the child's life which they were unaware of earlier. And the child is likely to be more responsible and the parent's anxiety greatly reduced. Play therapy creates a relationship between child and therapist. It modifies an old relationship between child and its family and gives insight into both relationships. It is an emotional classroom that teaches the children by showing the children other ways to be and by acknowledging their existing strengths. Play therapy is extremely effective. Vinity Gill is a registered psychologist and operates Moksha therapy psychology practice in Katoomba, New South Wales. Vinity conducts play therapy sessions at her practice but also trains adults to be play therapists for their own children. Vinity has been running a very successful training program for the past 6 years. The course is called Child-Parent Relationship Training and can be taught one-on-one or in groups. The one-on-one child-parent relationship training course runs for 1 hour every week for 10 weeks. The group course is also over 10 weeks, but the sessions are 2 hours long. During the course, parents will assemble a play therapy kit of their own, including toys and a playmat. They will learn the principles of play therapy, also known as rules of thumb, and by the 3rd week will be sent home to conduct their first play therapy session with their child. It is a very empowering program with parents reporting back that they found the benefits and change to their lives extremely beneficial, saying they feel more confident as parents and now feel like they know what to do. But most importantly, their relationships changed and they enjoy a closer and more positive bond with their children. One parent said, "I knew how I didn't want to parent my child, but I just didn't know how, but now I do." You can find out more by visiting the website at www.mokshatherapy.com.au.